Monday, Dr. Michael Schnaubelt with BayCare Clinic. We are here talking about hip replacement surgery. So first of all, tell us, who needs a hip replacement surgery?
Most of the folks who are doing a hip replacement have bad arthritis that's really affected their quality of life. They're not able to do things they normally like to do, whether it's things that they like to do for recreation or it's causing problems at work.
Like everyday things, right?
Everyday type things. So if they failed the traditional conservative treatments, anti-inflammatories like ibuprofen, maybe an injection, physical therapy, then we start thinking about surgery for these folks.
So who would be a good candidate for this? It's not for everybody.
No, it's not for everybody. I use roughly 50 and older as a guideline. Under 50, we try not to do it. There's rare exceptions, but generally people older than 50 in reasonable medical condition overall. Okay,
so after you know that you are a good candidate, what types of procedures are there? Different ones?
Yeah, there's a number of ways that we can do this type of procedure. Sometimes we'll do a hip arthroscopy, like a scope just to clean up the joint. But if they truly need a replacement, then there's a lot of different approaches out there. The traditional approach has been what's termed a posterior approach, which means going in from the backside. So we make an incision along the side of the hip into the backside. That's a posterior approach. That's been around forever, very popular, the way most people have it done. We've been doing it at Aurora BayCare through what's called an anterior approach, anterior meaning from the front. And that's a much smaller incision and has a lot of distinct benefits doing it that way.
Is there different recovery time for both of those?
There is. So the incision for an anterior approach or from the front is
the one
much
that you guys
smaller.
are doing.
Correct. It's literally the width of my 4 fingers on my hand. The other nice thing is we don't have to cut any muscle. We basically just spread the muscle and open it up like a book. So a lot less invasive, a lot less painful. The recovery, I've done these as an outpatient where people go home the same day.
Really?
And you really can't do that when we do it from the back. When we do it from the back or posterior, we're going through the gluteus maximus, the big muscle on your backside. And we also cut some of the small muscles as well. So it's a lot more painful, longer recovery that way.
And that's what I was going to ask. Typical recovery time for one of these?
For an anterior hip, I've had people go back to work as soon as like 4 to 6 weeks if they have low demand jobs. Full recovery, I usually tell people about 8 to 10 weeks. With a posterior approach, it tends to be more 2.5 to 3 months.
Wow.
So the recovery is a little bit longer. The other benefit doing it from the front is there's none of the traditional restrictions we put on people in terms of what they can and can't do after the surgery. So from posterior, the hip is more prone to dislocate or pop out. So we tell people you can't bend over, you can't pull your leg up to tie your shoe. Even sitting on the toilet is somewhat problematic. So there's a lot of things they can't do.
Big difference.
Crawling, getting around on ladders, things like that, we're not real happy with them doing from a posterior traditional approach. Doing it from the front, there's no restrictions on their motion, which is a huge benefit for patients.
Big difference for recovery. Wonderful. Thanks so much for being with us, Doc. For more information about hip replacements, the different ones, and to see if you might be a good candidate, just go to our website and click on this story. Well, it is Winter Awareness Week here in Wisconsin.